I'm Nadia Gurwell.
I'm John Goliatino.
I'm Michelle Blanchard. Welcome to 30 Minutes.
Hi everybody, and welcome to 30 Minutes, the Change Your Mind segment. I'm really excited today because I have a wonderful guest to share with you. My name is Doris Hanley and I'm a host. My guest today is Dr. Roseann Capanna-Hodge. She's a holistic psychologist and a neurofeedback practitioner. I feel very privileged because I have gotten to know her over the years through various holistic networking groups, and I am absolutely thrilled that you're here with us today, Dr. Roseann. How are you?
Good. Thanks for having me, Doris. You know, I love to spread the word about holistic mental health.
I would love for you to just share with our viewers a little bit about yourself.
Sure. So I grew up in Brookfield and still live in the area, and I am a mom of two boys and who are both special needs. One child has Lyme disease and the other is dyslexic, and they're awesome human beings. And
you've got your hands full.
I got my hands full. All moms have their hands full at all ages, right? You know?
Absolutely.
And I, live, like I said, in the area with my family, and I have a practice. Our main practice is in Ridgefield, and our other office is in Newtown. And I like to be extremely involved in community events. I am a big supporter of an organization based in Ridgefield called Lyme Connection, and we really believe in educating people about ticks, tick-borne illnesses, and I'm privileged to be part of that organization. I'm also on the board of the Northeast Regional Biofeedback Society. We try to promote and get people to understand, learn a little bit more about neurofeedback, and I'm on the board of Epidemic Answers, which really promotes children's wellness and healing. It's a great website if anybody wants to learn more about it.
I'm amazed. You get it done. You're involved in so many things. You definitely lead with your heart. I know that you're so passionate about everything that you do in life, and that's why I was so excited to have you on this show. Tell our viewers just a little bit about what got you into psychology, just in general.
Yeah, okay.
Just to start.
Well, thank you for those nice compliments. It's very nice. It was my calling. I actually never really considered anything else. So I really do believe a higher power put me here, and I absolutely am passionate about what I do. And I tell all my clients I will be here when I'm 85.
That's great.
So I really look forward, and I'm excited about going to be, it's my vocation. So how I got involved, I've always been holistic. I am the daughter of Italian immigrants, and we were just talking earlier, this region is filled with a lot of immigrants, and one of the earliest settlers of our region were Italians. So I have a holistic orientation, and so I always was involved in psychology. When I was in graduate school, right from the first semester, my research focused on holistic therapies for ADHD. And so I started out counseling as well as doing neuropsych psychoeducational testing, and I automatically, individuals, parents were gravitating with complex cases towards me. And what I saw, back then, I've been in mental health for 26 years, is that children seemed every year to be getting more complex the cases. There was a lot more medication. There was a change. There was a shift in mental health at that point. And so as I was working, and I worked in schools, I've worked in hospitals, I've worked in a lot of different settings, but at that point I was working privately. I had somebody come to me, his name was Tom, and he, to this day, had the most severe case of ADHD I've ever seen in my life. And he was a local kid. And absolutely amazing, wonderful parents who had exhausted every possibility what they could do with him. And when I say he had an extreme case of ADHD, literally he couldn't focus for more than 10 to 20 seconds, and had been kicked out of private school after private school. So, when I went to go observe him at school, it almost appeared, Doris, that he was having seizures. He was so out of control, out of his body, and he was struggling. And I forgot to tell you, he was intellectually gifted. So he was incredibly verbal and bright, but couldn't produce any work, right? any work.
So he
at
must
all.
have been so frustrated with himself.
So frustrated.
Yeah.
So his mom, lovely woman that she is, called me up and said, you know, they had tried different medications and he had had an adverse reaction, right? So 100% of people will have an adverse reaction of some kind to psychostimulants. The ranges are anywhere from appetite suppression to psychotic break to, in this case, he was having difficulty with his heart rate as a result of the medication. So she called me up and said, have you ever heard of neurofeedback? And I said, absolutely. It's incredibly clinically valid, and it's probably our most researched treatment for ADHD, including medication. It's highly effective. So she did it, and I saw her and Tom out about 8-9 months later, and he came up to me and said, how you doing, Dr. Roseanne? And he had never been able to have even that kind of a connected conversation. And I turned to her and said, what do you have him on? And she said, nothing. I have him, he did neurofeedback. And that just changed my world. And I really realized that I had to go and get trained, and I had to support my clients who were suffering like Tom. He wasn't abnormal. He was becoming my norm, that kids were really, really struggling. So that was really how I bridged in really bringing clinically effective therapies to my everyday and helping people move towards wellness.
And that was around 20 years ago?
That was about 15 years ago
Okay.
that I started doing neurofeedback and adding it in.
And do you feel like 15 years ago, were you sort of ahead of your time with that thinking of treating ADD, ADHD in that way, or?
I still feel like I'm ahead of my time.
I love it.
I am definitely a trailblazer, and I know that our practice and what we do is incredibly different from most places, not just in our region, but in the US. And how do I know that? Is people regularly fly in for our services, which is exciting that people come to us and we're able to really give them a lot of support, but sad, because sometimes they even come from, while I get people in rural areas come to me quite frequently, they're also coming to me from major cities. They're just not finding. The exciting part about all of this is that there is an awakening occurring with holistic health. And this is driving our change. This is what's driving the change in how people are saying, I'm sick and tired of being sick and tired.
Exactly.
And so people are finding different ways, and there are many, many effective ways that are research-based. And you just have to Google and look and find and talk to your friends. Not necessarily talk to physicians because they're not really being trained in this orientation, but some are, and they're seeing their patients making lifestyle changes, not just neurofeedback and biofeedback, but dietary changes, and the tide is turning. So that's really exciting. So absolutely 15 years ago, I was doing something very different. Very, very different. Nobody was talking about diet. Nobody was talking about any of those kind of things. Now it is still, we're still cutting edge and different, but people at least have been primed and maybe heard about it and read about it, and so they're open.
So would you say a lot of your patients that come to you are on medication, and is the goal to get them off medication, or do you just say, we're going to do this biofeedback with you being on your meds, let's just see how it goes over time? Like, do you find a place for medication?
So that's a great question. So first of all, our whole office is built on providing absolutely clinically based, research-based, and extremely effective alternatives to medication. However, I have 2 people walking in my door of all ages, people that are actively avoiding medication of all kinds because they've become literate. They understand that every single medication has a toxicity, every single one, right? Okay, unless you're on thyroid medication, and even thyroid medication and overusage can be toxic, right? So please take your thyroid medication. I'm not saying don't take your thyroid. But the other kind of person is somebody that is on medication and has had an adverse reaction. I have a small subset of people who are on medication and it's effective, but they still want something different, or they've brought their friend came in, or their child came in, or their grandfather came in, and they saw such a positive change, and they again, had their own awakening.
Right.
So what happens in our office is that our treatments are, so research-based and so effective that, particularly with neurofeedback, once you regulate the brain, you will get to a point where you have to, a crossroads, as I like to explain to people, where you have to make a decision. Your brain is no longer going to need this medication at this level. So do you titrate down with the support of your prescribing physician, or do you leave it as is and just move on? I've got symptom improvement. And that's unique to everybody.
So you can work very closely with an individual.
Yeah. And most physicians are very supportive. They want their clients, their clients to get better. So it's a unique process depending on what it is. Certainly, I work with a lot of children and college-age students and even adults who want to get off their ADD medications. That's an easier medication to be on and off and titrate down. Your psychiatric medications are challenging and can produce a lot of negative side effects. And that really has to be done incredibly closely with their prescribing physician. But the exciting part is there are many alternatives that are incredibly effective for mental health that don't involve medication.
And so yeah, I'd say just describe more your platform for healing.
Sure. So, what makes us different in our office and unique is that we really believe in integrated mental health, and that we don't offer one thing. We offer a variety of incredibly holistic treatments. What I like to say is we bridge neuroscience with clinically effective treatments, right? And that includes everything from neurofeedback and biofeedback and, supporting people in nutrition changes, just a whole list of things. And of course, psychotherapy. We believe in psychotherapy. So, what we really try to do in our platform of healing is I try to do a lot of psychoeducation. So what happens and what we're ignoring in mental health is the impact of outside variables on the central nervous system. So if our central nervous system is constantly, when I like to use a visual of, this, imagine our central nervous system, this is, 0 and this is 100. When our central nervous system is in alignment, which means our sympathetic and parasympathetic nervous system are idling at a normal range, we feel good, we don't have physical symptoms, we don't have mental health systems, our body is in alignment, right? But what's happening today is we have a lot of variables that are causing our central nervous system and our our parasympathetic and sympathetic nervous system to get out of alignment. And so it starts idling at a higher range that is causing people to experience distress. And when your nervous system is overactivated, you lose control of your rational thought, right? So what I really have tried to explain to people is you have control of these variables that are impacting your central nervous system. So in order for healing to occur, you have to look at nutrition, and that's not just what you put in your mouth, it's also nutritional deficits. What are genetic issues that are impacting you? We're having a huge rate, an increase in genetic mutations. 50% of the US population has a genetic mutation that's related to the processing. We lack an enzyme in processing the B vitamins. Without processing specifically folate, without the enough folate, your nervous system can't work properly. Almost everybody is vitamin D deficient. And
unless you're bronzed.
But even then, there's so many. Right, I know, I get out in the sun. Don't put sunblock for the first 15, 20 minutes. So nutrition, genetics, sleep, right? Sleep is the foundation of healing. And for a lot of reasons, I know a lot of teens that are doing sports and they get home and they're working and they're doing homework till 11 or 12 o'clock at night, and then they have to get up at 6. That's not enough to support healthy brain functioning, right? We have women in perimenopause, they're not sleeping. We have dads working, and mom and dads working long hours. Just a lot of impact. And so sleep is a foundation of healing, right? And so the other foundation of healing is getting your nervous system to align and be more regulated and not idle in this at the top, right? And so that's when a lot of these other treatments come in. Go ahead.
I have to ask you this question because I'm a simpleton in this department, right? I'm not educated in what you're talking about. I'm trying to make sense of what you're saying. And I've heard people talk about the fight or flight response versus your higher brain. So where your creativity comes from, your higher thoughts, your big thoughts, right? So the fight or flight response, is that what you're talking about?
So what happens is when your central, your CNS is idling at a rate where it's, I like to say to people, agitated, right? Because that makes sense to people. People can understand that. Yes, flight or fight response can be part of it, or freeze is also part of it.
No longer a bear, but it's your stress of your day.
It's your stress of your day. What's happening is when you keep yourself in this agitated state, stimuli that shouldn't overstimulate you overstimulates your system. So instead of saying, well, there's traffic on I-84, all right, there's always traffic on I-84. The next thing you know, you're swearing, you're hitting your horn, and we all live in the area, so we've all been there. But this becomes your normal response, right? So, or noise irritates you, or your kid who has impulse control issues irritates you even more.
Or I have one. For all those kids out there, the high achieving kids or the parents that want the very best for their children and tell them to do well in school, I was one of those. I was kind of trained to get butterflies before a test. It's really does not serve you well at all.
It does not serve you well,
but that whole process of running around with butterflies is pretty easy if you catch it early on, but if it becomes part of your hard wiring over time, it can just tear you apart.
And that's a great point. And when I think about these 26 years that I've been working in mental health, what I have noticed is a trend, very, very strong, particularly in the last 10 years, and absolutely in our region of the country, but I work with people all over, so it's happening all over, is people are accepting stress and high levels of stress as a daily part of their life. And they're not incorporating ways in their daily life, so a daily practice of stress reduction, right? So at our office, what we do is we really offer ways to direct treatments to get the central nervous system in alignment, right? So reduce those agitation, that flight or fight or freeze response. And so neurofeedback and biofeedback is one of that ways. We offer traditional psychotherapy, but we also do psychotherapy where we help to deactivate the central nervous system, like EFT tapping and hypnosis and somatic work. So we do different ways so that people can get their nervous system. And then we teach you about lifestyle, right? So what are ways I'm going to continue this? I'm not coming to neurofeedback forever. I don't want you to come. But you know what? You can do biofeedback at home. You can meditate, you can do yoga, you can go to the gym every day, you can walk with your neighbor Betty. These are ways to really support the nervous system, and I can tell you this, that if your nervous system is constantly idling in this high level, agitated, stressed response, healing in your body's not going to occur. So this is why we have a dramatic increase amongst other reasons. It's a variable in autoimmune disease and people just not feeling well and sleep problems. So it starts causing, the lack of sleep causes the body to respond improperly, and then, it just is a vicious cycle.
Slow breakdown over time.
It's a slow breakdown.
So I don't want to assume that anybody knows exactly what these words mean. So go into a little bit more detail about what exactly is neurofeedback and biofeedback.
Great.
Like if you just could explain it a little bit more.
Sure. So, at our biofeedback and neurofeedback are two separate therapies. At our office, the first step of before biofeedback and neurofeedback is something that I absolutely love called QEEG brain mapping. And so it's a way to get a visual representation of people's brain waves to understand diagnostically what's going on. So people come in, they put a cap on, it measures the surface electrical activity of the brain, and then we pop it into a computer, it's statistically analyzed, and then what I do, and I interpret my own brain maps, is we look for certain formations of certain brain waves are associated with certain conditions. So if you have a lot of slow wave brainwave activity, you're going to have a focus problem. If you have too much high communication in your brain, you're probably anxious. So there's really readable patterns that really help. I take brain maps to the next level, and I can see a lot of health issues, I can see nutrient deficiencies, I've been doing this a long time, and then I send you to the appropriate medical person. That's a whole other thing. So biofeedback is all about learning how to consciously control your autonomic functions, which is a fancy word for breath. You know, your heart rate. You can actually learn to control your skin temperature. You can do all of those things. So it's a way through technology to learn how to do that, and it's the goal of that is typically used for anxiety, it's used for pain reduction, and we teach you how to do that. Neurofeedback is different. We're accessing the subconscious, and through supporting the subconscious and through the use of computers, we reinforce and reward. You're changing your own brain waves. You actually can change your brain waves through a process. And and so what happens is you come in, you're using a computer, and I, through this QEEG, have determined, okay, you know, Frankie needs to reduce this brainwave, increase this brainwave, and it's going to reduce his, you know, get his brain to regulate, reduce his stress or whatever it is. And it's a really simple process. They come in and your subconscious within 2 to 3 seconds of the first time you get hooked up
You're sitting
starts
there
changing. Yep, you're
watching
sitting there.
a screen.
You're watching a screen.
Right.
Most people watch a movie. Some people, like myself, watch these Zenny screens. And what happens is, in order for the screen, the movie to play, and for you to get a variety of reinforcements, both visual and auditory, you have to produce the right combination of brainwaves. And the process of neurofeedback is like working out. You really want to do it 2 or 3 times a week. We want to gently move those brainwaves so that it learns a new pattern. What's exciting about neurofeedback is the changes are lasting. Once you're done. People maintain those changes over time. And in fact, the research shows us that often the brain actually continues to improve as far out as 10 years later, which is pretty amazing.
And can any age be
So
changed?
with neurofeedback, I start as young as 3.5, and I have easily worked with people in their 80s. Most of my elderly clients that I work with typically are coming in for anxiety or pain, but and anxiety across every age is the typical reason people come in. I mean, I work with neurofeedback, biofeedback, as well as something called PEMF. We work with anxiety, autism, a lot of people with focus and ADHD.
What about like PTSD?
Oh, fantastic question. So we not only do a lot of brain-based treatments for individuals with PTSD, all ages. We worked with 1214. We worked with a lot of families, a lot of children, with both neurofeedback and psychotherapy, but we use a couple of special types of psychotherapy techniques. One is EFT tapping, another is hypnosis, and the other is somatic body work. And so we really, you know, the body holds trauma. There's a great book called The Body Keeps Score by Bessel van der Kolk. And it's about how there's a lot of physical manifestations for PTSD, but also the trauma doesn't want to leave your body, right? So when you kind of talked about flight or fight, right, that's what happens with somebody in PTSD. They're always in this activated state. So it doesn't, you have the extreme of PTSD, and you have the norm, what's going on today, where kids in particular, are in this constant stress state because of developmentally inappropriate education that we're pushing on kids today. It's a whole other topic. Younger and younger. I'm getting much younger kids with stress. But what's happening is we're trying to do traditional talk therapy when the rational brain is not functioning because they're in an agitated state. Their parasympathetic and sympathetic nervous system are completely out of alignment, and they're just agitated. The nervous system is agitated, and that nervous system agitation can show up as irritability, can show up as depression, it can show up as social anxiety, it can show up in reduced eating, it can show up in overeating, it can show up in a lot of ways. So by changing some of those variables, you're able to get the body in alignment. But PTSD, you know, I recently had somebody come to me, and they had numerous traumas over the years, and are functioning, and they should be proud that they're functioning. But never once in 16 years of trauma has she ever gotten trauma-informed care, and that really is about supporting the subconscious in releasing those traumas. So we do a lot of work, not just neurofeedback with subconscious and trauma, PTSD. Cool stuff.
That's amazing. And could you just say, is there a typical length of time, or is everybody unique on this?
So when I do a brain map, what I do is I'm able to tell you what you need. And so sometimes it's neurofeedback, sometimes it's psychotherapy, sometimes it's not anything in my office, quite frequently. I like to work with naturopaths. We do holistic health coaching in our office. So when you come and sit down, it is unique to each person. However, neurofeedback, you really can get a sense of pretty quickly how is their brain responding. So there's something called neuroplasticity, and that's just flexibility of the brain. Children under age 8 have an incredible amount of neuroplasticity. I mean, when I work with a young kid, it's pretty unbelievable some of the changes that can happen. It's really like just exciting, right? I think one of the best things I get to do is I get to be part of healing in such an awesome way that there's really no negative components of anything that we do, and so I love that. It's really
safe.
It's safe. It's so safe. And neurofeedback, 3,000 peer-reviewed studies. There is not the same with medication. There's nothing even close to that. American Academy of Pediatrics says that neurofeedback is the same effectiveness as medication. We're rated level 1. I have a lot of awesome pediatricians in the area that refer to us because they know that. There's a lot of pediatricians that are not aware of that. So they're not conveying that message to parents. What I'm finding is parents are finding us and going to their pediatricians and asking. And then they get a decent response or whatever response, right? You know, so yes, absolutely.
So what I like is that you can integrate with anybody's process, whatever it is that they're doing, whether it's medication, whether it's very young. You can actually teach an old dog new tricks. I like that. You know, in a safe and effective way, which to me is the wave of the future, looking at the whole body and really focusing on healing and not just over-medicating, dulling something and hoping.
We're really about root causes, right? And so I spent a lot of time training and understanding not just, you know, how the brain responds, but how the body responds. And so we offer that integrated piece. We're able to guide you in the right direction, and that's really important. And yes, it's synergistic with a lot of things. I work with chiropractors, integrative MDs, yoga therapists. I mean, you name it, it's really helpful. And psychiatrists. I mean, you know, a lot of my psychiatrists that I do work with, they want their clients well, right? We just unfortunately are being dictated by big pharma on what is prescriptive for mental health, and we need to change that.
I feel like I could talk to you for hours and hours, and unfortunately our time has run out. But I will say that what intrigues me is any holistic modality where you can actually change your mind. And you've just proven right there that it is possible at any age to make a positive difference and heal yourself. So thank you so much for joining us today for 30 minutes and the Change Your Mind segment. Have a great day, guys.